Hi everybody, this is Dr. A again. We are going to continue our video on collecting samples. So this is the second video. We're going to look at collection variables and tube selections. Alright, so first the phlebotomist, they are the lab's ambassadors. They collect most of the blood samples. Phlebotomists should always be clean and professional. The long hair should be tied back. There shouldn't be any dangling jewelry, and the nails should be short and clean. And so this is in part for patient safety, but also for the safety of the phlebotomist. So, you know, being the face of the lab, you really want to present yourself nice and neat and professional. That builds trust with the patient. If you come in with crumpled up, frumpy looking scrubs that are smelly and dirty, you're not going to inspire confidence. The long hair should be tied back because when you lean like forward here, that can get in your way, and then also patients could grab and pull it, so you want it pulled back. Same thing with dangling jewelry. You never know how a patient may react. They may be combative, and so they could grab and pull. It could be really dangerous. The short, clean nails is because nails can harbor a lot of bacteria, can be a source of infection and spreading of infection, and so it's good to have short, clean nails. A lot of hospitals even have some requirements as to length, and they don't allow fake nails. So the collection tray should also be clean and presentable, neat and tidy. Should not have blood splatter all over it. It should not have a bunch of trash from used up alcohol wipes or band-aids or things like that. Nurses can also collect samples, so they also interact with patients and can act as phlebotomists, especially in the emergency room and in the intensive care unit. And specimen collection is where most of the lab errors occur, and so it is important that the process be thoroughly understood and that each collection is done with the most care and attention to quality. And of course, the phlebotomist should always be diplomatic. So let's look at some blood collection variables. So the type of sample that is needed for testing could be whole blood, could be serum, or could be plasma. And depending on the need, then there's going to be various tubes that could be collected to meet that need. The fasting state of the patient needs to be noted, especially if the collection requires a fasting sample. So fasting should be 8 to 12 hours with no food or water. And if it is a fasting sample, then again, that should be denoted on the collection slip. If it is a postprandial collection, which means after a meal, then the time when the meal was eaten should be noted, and then how long it's been since the meal. Don't collect during IV infusion. Now, that is possible that can't happen because a patient is on an IV infusion 24/7. So then you have to work around that. And you know, things to look for is to collaborate with the nurses. If it's infusing an antibiotic and you're trying to check an antibiotic level, you need to make sure that the antibiotic is done infusing, and you really just need to work with nursing staff there to do an appropriate collection. You also don't want to collect around or close to that IV, because you can get contaminated blood. Blood that's contaminated with that IV fluid could be diluted. You know, it could really throw off the results. Sorry about that. I need to put my phone on silent. There we go. Okay, so other variables: food intake, if they've just eaten or not; activity, if they've been active or not; medications and time of day can all affect the results. So other things that can affect it also are posture. So if the patient is sitting up or laying down, immobilization, so that would be like bedbound for an extended amount of time, whether or not they've exercised. Again, exercise activity kind of overlaps there. Circadian, diurnal rhythms, variations. So circadian have to do with a 24-hour cycle. Diurnal is more like a day-night variation. Any recent food ingestion. Again, food intake, food ingestion, that, you know, kind of overlaps there. And whether they smoke, have recently smoked, and or ingested alcohol. All of those can affect the results. So two general sources of blood are going to be venous and capillary. So a venous sample is a sample that's drawn from a vein. That's going to be the bulk of the samples that are sent to the lab. A capillary sample is a sample that's obtained from a finger stick or maybe a heel stick on an infant or newborn. Arterial blood can also be used for blood gases, but as a general rule, in most hospitals, arterial blood is collected by respiratory therapists, but there are some hospitals where the lab may collect arterial blood. And then we need to look at the difference of serum versus plasma. And so what serum is blood that has been drawn from a vein and allowed to clot in a tube that really has no additives, or it can have a serum separator. We're going to talk about that. But it's allowed to clot, and in the formation of that clot, all the fibrinogen and clotting factors are used up making the clot. So you have a good solid clot, and you want to wait until that solid clot has completely formed throughout the tube before you centrifuge the tube. Once that tube has gone through centrifugation, then what's left, the layer on top of the cells that have been spun down, is serum. And so serum lacks fibrinogen and clotting factors. Serum can be an ideal specimen for certain things or certain drugs or hormone levels whose levels could be affected by the fibrinogen or by the clotting factors. Now, plasma is anticoagulated blood that has been spun down. And the type of anticoagulant used varies, and we're going to cover that in just a minute. So the plasma still has the fibrinogen and the clotting factors, and that's the biggest difference between plasma and serum. So on a tube that's been spun down and a blood that's been anticoagulated here, the top layer is going to be plasma. It is going to be more than half of the sample, and that is for a patient with a normal blood volume, a normal amount of red cells and white cells, etc. So again, it is about 55% of the total blood volume. Next layer is going to be, my cursor, there we go, the buffy coat right here. So the buffy coat is a grayish-white coat. It's made of white cells and platelets. It's normally only about 1% of total blood volume. If you see a really thick buffy coat, then you can expect a really high white count. So they either have a severe infection or they have a leukemia. And then the layer beneath that is going to be the erythrocyte layer, or the red cells, and it's normally about 45% of the total blood volume. And they will be at the bottom. So there are some environmental factors that are associated with evacuated blood tubes that we need to look at. So most of the time when we draw blood, we use these collection tubes, and these tubes have a vacuum. The vacuum has been built into it by the manufacturer so that when it is inserted on a blood collection device that is usually called a vacutainer, that's been inserted in a patient's vein, and you push that tube on there, the vacuum is going to pull the appropriate amount of blood into the tube for testing. But there are some things that can affect that. So ambient temperature is the first one. Low temperatures will decrease the pressure inside the tube and lead to an increased draw volume, because by decreasing the pressure, it's creating an even bigger vacuum. And so it's going to pull a little more blood than it's supposed to. And then high temperatures will do the opposite. The altitude, so drawing samples at high altitudes where the ambient pressure is lower, then the pressure inside the tube will reach the ambient pressure sooner, and then that means the vacuum won't be as powerful, and so it will lead to a lower amount drawn. So you could have a short draw. That's possible if drawing the sample at high altitude. And then the humidity affects mainly the plastic evacuated tubes. It doesn't affect the glass ones, but high humidity can cause the water vapor to enter the tube, and so that could contaminate the tube and further dilutes the anticoagulant. And then low humidity could dry out a wet tube additive also. Light, certain additives can be sensitive to light. Most of the additives that are commonly used are not sensitive to light. You just have to know that some of them could be. And if it's sensitive to light, usually those tubes are stored in a cabinet behind a closed cabinet door, so away from light. Then you need to note the expiration date of the evacuated tubes. That's really important. It is determined by testing the shelf life under known conditions. So the shelf life of an evacuated tube is going to be defined by the stability of the additive and the retention of the vacuum in the tube. The average is 12 months under the recommended storage conditions, and a short draw will happen if there's a loss of vacuum, so it won't pull a sufficient amount of blood into the tube. And short draws are the second most frequent cause of the rejection of a specimen. So next we have some additives. So there are some additives that can be added to these tubes at the proper concentration to enhance the accuracy and consistency of test results. So you have anticoagulants, which prevent coagulation of whole blood and therefore yields plasma or whole blood for testing. So those are dipotassium and tripotassium EDTA. There's sodium citrate and heparin. And it's usually lithium heparin that's used the most, but sodium heparin can be used also. Then there are also additives. These can be clot activators, serum separators, or preservatives such as sodium fluoride. We're going to go into detail on each one of those here in just a second. There is a potential adverse effect of the additives, so you have to know that these tubes are not often interchangeable. So it could interfere with an assay, especially some of the serum separators can trap certain drugs or certain hormones and things in them, so you can't use those for it. It could remove a constituent, so a couple of those anticoagulants bind calcium out. It could affect enzyme actions. It could alter the cellular constituents, and if there's an incorrect amount of anticoagulants, it can also, if the ratio of blood and anticoagulant is off, it can affect the results there. So let's dive into the anticoagulants. The first one is EDTA. So again, dipotassium or tripotassium EDTA. It is a calcium binding agent, so we'll bind the calcium out of the sample. It is ideal for blood counts and blood count incising because it does not shrink the cells. The EDTA is spray dried on the inside of the tube, and the tube has a purple colored top to identify it as an EDTA tube. And it is often used for CBC and all the tests associated with the CBC, so like a hemoglobin hematocrit also. With an ESR or sed rate, it can be used for blood typing, and it can be used for the hemoglobin A1C. Those are the most commonly used tests for the purple top EDTA tube. The next one is the sodium citrate. It also removes calcium. It is often used for coagulation testing, so the PT and PTT testing, fibrinogen D-dimer. It can also be used for the Westergren sed rate, which is the original sed rate test. And for the sodium citrate or blue top tube, it's a light blue top, the correct ratio of 1 part anticoagulant to 9 parts of blood is critical. Heparin is the next one. It's in a green green top tube. Heparin acts as an antithrombin, so it binds to antithrombin 3 and blocks thrombin formation and therefore blocks clot formation. Lithium heparin is ideal for all your chemistry tests, so your basic metabolic panel, checking a potassium electrolyte, blood sugar, kidney function, all of those are ideally done on a green top. It can also be used for blood gases. Next, we're going to look at the additive ones. So the clot activators, they promote coagulation so that you get a good stable clot. They are either thrombin, glass, or silica that's coated on the inside of a tube. And the tube is usually red, has a red top at the top of it. Next, you have the serum separators. They are a polymer gel, and they do physical and chemical separation of the blood components. So it allows for storage long-term in the primary tube without having to pull off the plasma or the serum and put it in a different tube. So what happens when it's centrifuged is it moves above the cells but below the plasma. So first, these tubes are identified by either a gold top or a light green top. So the gold one is going to be a serum tube, a clot activator with a serum separator. And I'm going to move my camera just a second. You can see it right here. Here's the gold. And the light green one is going to be a lithium heparin tube, so same as the dark green, but with an SST in there also. And so what happens is that initially the gel is at the bottom and the whole blood's on top, and then when it's centrifuged, the cells move at the bottom, and then you have the gel, and then you have the plasma or serum. So this would be serum because it's a gold top. The equivalent of the gold top is also this tiger top right here. So it has a gray, red, marbled look. And so they are both, they have the SST and have a clot activator in them. So they're equivalent. They're just different brands or different types of tubes. And then the preservative one is the sodium fluoride, which is the gray top. It preserves blood glucose by preventing glycolysis. It can also be used for lactate levels. And I've seen it often used in legal blood alcohol levels. So it stops metabolism of glucose and things, and so it can be used for those more specifically. And then, labeling tubes, very, very important. So first, for best results, once blood has been added to the tube, whether it has a clot activator or an anticoagulant, you want to gently invert the tubes, okay? Don't shake them. And you want to preferably do this as you collect them, especially if you're doing several in a row. Every time you pull a full tube off of the vacuum hub, you want to just mix it gently and set it down. You want to label the tubes with a barcoded label applied vertically so that the machines can read them. And the reason you want to do this correctly is if you put it at an angle or if you put it horizontally, it's going to cause the lab tech that receives the specimen to have to relabel the specimen. And anytime you have to relabel a specimen, there's a potential of an error occurring in it being relabeled with the wrong label. So if that's the case, so whether you're relabeling or initially labeling the sample, you do want to make sure and double check that you grab the right test label on the right patient. This is especially important if you have multiple patients' orders on your tray or you have multiple of them laying around. It's very easy to grab the wrong one. So always double check that you are indeed getting the right label on the right tube for the right patient. Always note your date and time of collection and initial the tubes. And then last, we're going to talk about the order of draw. So this is very, very important because the additives and the anticoagulants can affect the results. There could be some cross-contamination. The ideal order of draw has been established and needs to be followed. So if you start with your collection device, right? So we're going to use a butterfly as an example with a hub attached to it. The first thing that you can draw, the first in the order of draw, are going to be the blood cultures. Usually a couple of bottles, aerobic and anaerobic. The aerobic is green, the anaerobic is orange. There is a hub that is wide enough to accommodate the bottles that are pictured here, but there are also some bottles that have more of a long neck that can fit the standard hub of a butterfly. Okay, so once the blood cultures have been drawn, the next tube in line is going to be the blue top or the sodium citrate. This is an adult one. This is a pediatric one. Next is going to be the red top and then the serum separator or gold top. These are both clot tubes. Just a gold one has a serum separator. Then next is going to be your lithium heparin. And then if you had a lithium heparin with the SST, it would go right here. Then we have your EDTA, and then that is your purple top. And then we have a pink top, which is also an EDTA, but it's usually specifically used as a retype for blood bank. So these are the same stuff in them. And then last is going to be the sodium fluoride. So this would be your lactate levels, or if a glucose has been ordered specifically in a gray top, and you can do that. And then this last tube portrait is an ACD one. It's not used extensively. It can be used for fungal cultures or other things. I just wanted to put it in there because it's used some, just not a lot. So the tubes represented here are going to be the most used tubes. So again, blood cultures, blue, red, and then you have the gold, and then we're going green, purple, and then gray. So the pink can be after the purple, but really purple and pink are really the same thing. So there you go. That wraps up your blood collection, sample collection. Next, we're going to talk about the types of equipment used in venipuncture, and then later on I'll post a video about venipuncture. So again, thank you for your attention, and I'll see you in the next video.